Next, it's exciting for me to introduce someone that really needs no introduction to our MU Extension family. Dr. Kathleen Quinn has become a part of our team. We were fortunate a couple years ago to convince her and other leaders in the College of Medicine that it would be a good partnership. I do want to thank our friends in the College of Medicine for working with us in that. Dr. Quinn brings a wealth of experience and background and expertise in the area of rural medicine and healthcare. Does a beautiful job of working with our Rural Track program and so many things that have really helped to extend medicine and healthcare into the state of Missouri. She is a native Missourian. She just told me a few minutes ago, born in Kansas City, raised in Columbia, and she would be one of those people that you would say is all about Missouri. So again, she serves in her role as Associate Dean for rural health care and working in the College of Medicine, but also serves as a program director for us and looking at health and all the areas that we're trying to grow in health. And when I think back to 2017 and the challenge we took on to really begin that process of climbing that mountain to say how Extension would be involved in that conversation going forward, one of the first things we did was begin this process of bringing Dr. Quinn on board. So Dr. Quinn, we're glad to have you today and looking forward to your comments.
Thank you, Marshall. And I have to start out by saying that I didn't really need to be convinced to come to Extension. It's been a great part of my career. Even though it's been only 2 years, it's been wonderful. So thank you for the opportunity. Today I'm going to be talking about the Office of Health Outreach, Policy, and Education. The objectives of my talk today are to increase your knowledge of the Office of Health Outreach, Policy, and Education, which we call HOPE, how it was developed, and how the divisions are aligned. I'll also talk about how HOPE is positioned to solve rural health challenges, which is a key aim of the Next Gen Precision Health, by leveraging existing relationships within HOPE and amongst healthcare providers. So Dr. Marshall Stewart was brought on as the Executive Vice Chancellor of MU Extension and Engagement 5 years ago, and upon arrival, as you know, he conducted a listening tour in all 114 counties to learn about the priorities for Extension from the county's perspective. From this information, the 3 grand challenges came to be. And as you know, they're educational access and workforce preparedness, health and well-being, and economic opportunity. He restructured Extension to ensure there were boots on the ground in every county to meet the defined challenges. The new structure allows Extension to better integrate itself into the communities and to gauge needs to be immediately responsive to the needs as they evolve. During this time, President Choi was beginning to work and create the Next Gen Precision Health efforts, which includes bringing research innovations to all corners of Missouri. Dr. Stewart decided to innovate by building a partnership between MU Healthcare and MU Extension to achieve the collaborative priorities of both Extension and Next Gen. So in January of 2020, this partnership was created, and it demonstrates MU's integrative approach to community health, as well as its commitment as the land-grant institution to improve the health and well-being of Missourians. As Marshall mentioned, I was asked to be the Senior Program Director for Health and Safety and also continue my work with the School of Medicine. This combined effort led to forming HOPE, bringing together divisions from both the School of Medicine and MU Extension. The divisions include the Rural Track Pipeline Program, Missouri Telehealth Network, the Center for Health Policy, Continuing Education for Health Professions, and the new program area, Community Health Engagement and Outreach. HOPE was created as a focused and deliberate partnership to help carry out the vision of this unique collaboration. And what is unique about it is that it's the only focused directive of its kind at a land-grant university. HOPE will work to translate MU School of Medicine research and initiatives to practice, increase connections and outcomes with internal and external partners, develop health promotion resources, and partner with the Sheldon Clinical Simulation Center within the School of Medicine to provide education and resources, and offer assistance to Missourians, helping them to thrive at every stage of life. So the mission, once we were brought together, we decided that we needed to come up with a mission of hope. The mission of hope is educating and preparing not only current rural providers, communities to achieve optimal health, and health profession students who will one day work to serve rural communities. Innovative in creating data-driven, evidence-based tools, ongoing research in support of policy, communities of practice, and educational programs. And finally, leading, partnering, and supporting policy solution influencing access to health, the communities, and people with the greatest need. Salient features of our work include utilizing principles of health equity and inclusion, which has been talked about quite a bit this week, which has been extremely inspiring. Using our diverse skill set, building relationships to increase effectiveness, staying committed to our work and extending the work to communities we serve, translating data into useful strategies, continuously improving our work, advancing the body of knowledge, and modeling collaborative, transparent work to increase effectiveness. So now I'm going to talk briefly about each of the divisions. The first division is the Office of Rural Health. The Rural Scholars Program addresses the critical physician shortage in rural Missouri by recruiting rural background students and providing them experiences by immersing them into rural healthcare practice and preparing them to work in areas of need. For 25 years, our rural program has produced physicians for our state. About 55% of our graduates practice in rural locations, and 80% of our physicians stay in Missouri. The Missouri Telehealth Network. ECHO stands for Extension for Community Healthcare Outcomes. We use video conferencing to help primary care providers all over the state join learning collaboratives with specialty teams to learn about specialty care and how they can take better care of their patients. We offer these sessions regularly in over 30 topics like diabetes, mental health, autism, asthma. These are fun, shame-free, supportive conferences, and primary care providers get free education credits for participating. The MU Center for Health Policy. The mission statement for the Center for Health Policy is to promote well-being and access to equitable health care for all Missourians, again, particularly those with the greatest need. The salient features that guide the work of the Center for Health Policy include choosing projects that improve the health and well-being of Missourians. They're nonpartisan, highly skilled, and well-connected to support policy analysis. They work to build and develop relationship with key stakeholders. They're a resource for institutional knowledge and the history of Missouri health policy, and they're a trusted resource for nonpartisan information. The Center for Health Policy, their strategic plan, prioritizes research, scholarship, creative works, inclusive excellence as a center, and learner success in both traditional and non-traditional educational settings. And this slide lists some of the projects that the Center for Health Policy currently conducts. And I'll be talking a little bit about some of these later on. Continuing education for health professions. The new Continuing Education for Health Professions was initially formed by the merger of MU Nursing Outreach and Continuing Medical Education, both of which had incredibly rich histories dating back more than 50 years. The CEHP mission quickly expanded to encompass as many disciplines from across health professions as possible to design, deliver, and evaluate accredited continuing education programs in Missouri and beyond. CEHP produces traditional live conferences, live virtual and hybrid events, and on-demand enduring materials. They also serve a single point through which accreditation may be achieved from various state, regional, and national accrediting bodies. And I really appreciate the two staffs coming together this past summer to form Continuing Education for Health Professions. Community health engagement and outreach. The creation of a new extension unit called CHEO demonstrates MU Columbia's integrated approach to addressing the grand challenge of health and well-being. Focused on community and population health with providers and researchers throughout the university system, CHEO aims to close the healthcare and healthcare gap with high-touch community health approaches that link community resources with university resources. This integrated interdisciplinary process to health creates synergy, leading to opportunities for disease prevention, improving health literacy, translating research to practice, optimizing data collection, and adopting place-based strategy for collective impact. CHEO's vision is to touch every part of the state with innovation and knowledge and create an environment where Missourians thrive at every stage of life. CHEO is a vivid example of transformational engagement principles at work. The program's creation represents the confluence of research and scholarship, clinical training and practice, and public and community health needs. It will help bring the promise of all things Missouri to rural communities and urban neighborhoods where health challenges abound and where resources have been historically scarce. Since the implementation of HOPE, the divisions have worked to bring our efforts together while also maintaining their separate identities. Working together makes HOPE uniquely competitive for external grants and contracts. And as you can see from this slide, we have quite a bit of external funding. And as we've gone over the last couple of years forming the Office of HOPE, our partners and sponsors have been just so much engaged with everything that we can do with data, with community health, with continuing education, with workforce development. So it's really worked out well working together rather than as separate divisions. So to talk about some of the collaborations and partnerships that have come from HOPE, I just wanted to point out a couple. For example, with the Missouri Telehealth Partnership with MU Extension, we create local and regional awareness of Show Me Echo in order to improve care to Missourians. We have 23 Extension faculty that are contributing to this partnership. Extension specialists are gaining a deeper understanding of the Show Me Echo programs and then meet with local stakeholders to offer education on the benefits of ECHO, encourage participation, and identify unmet needs within individual communities. It's been a great partnership, and the participation in Show Me ECHO has increased due to this partnership. Another example is, well, we've talked quite a bit about the recovery-friendly workplaces that foster a culture that promotes employee safety, health, and well-being through strategies that include recovery resources, education, providing technical assistance, and reducing the stigma related to challenges surrounding substance use disorders. Several states, corporations, and organizations across the country are implementing plans to combat the economic impact of this crisis by supporting employees affected by substance abuse disorder and on a journey to recovery in the workplace. And finally, the Healthcare Workforce Project. It's a partnership between the Center for Health Policy and the Office of Rural Health. It's committed to building the knowledge and tools to understand the characteristics and predict the future needs of Missouri regarding healthcare workforce to ensure equitable access to care and serve Missouri's population. The Healthcare Workforce Project implements and analyzes surveys to understand the demographics, skills, and workplace characteristics of our workforce to support policy development and provider needs. If we don't know where our providers are practicing, it's hard to know where we need more nurses, physicians, PTs, OTs, etc. So it's been a really great project. Possible future collaborations include a precision health cancer care echo to promote the adoption of the genomic medicine and cancer diagnosis and therapy, and the creation of a clinical research training echo. So we're excited about those opportunities in collaboration with MU Healthcare. Next Gen. We've heard a lot about Next Gen this week, and in 2019, the system launched the Next Gen Precision Health initiative inspired by the National Institutes of Health, focused on precision medicine and precision health. The initiative will accelerate the research and activities of the UM system's 4 universities and health system. Developing a seamless research practice partnership is critical to the success of this initiative. Thus, combining the high-tech next-gen precision health research and innovation with the high touch of MU extensive programming and on-the-ground specialists across the state enables a clear transitional pathway to increase lifelong health and well-being of individuals and communities in the state and beyond. The partnership between MU Extension and Next Gen Precision Population Health provides such a conduit, building upon MU's substantial knowledge and skills of campus faculty and statewide partners, and decades of experience planning and providing technical assistance and training. For example, as Hope builds statewide trust, it now serves as the bridge to information, education, resources, people, and organizations at the state and local level. MU Extension and Hope are valued partners at the table and are strategically and efficiently connected to community. Through NextGen, the university and system will strive to identify future community health issues and work upstream to ensure initiatives are focused on the whole person's health and well-being. It is important that we not focus on what we can gain from our relationships, but instead how we can cultivate long-term relationships where we add value and create opportunities to improve the health and well-being of those in our state. Trusted, community-level relationships are the foundation from which we can build. However, it's essential that we do so thoughtfully and strategically. And I truly believe, Dr. Stewart, that this partnership with Extension and the School of Medicine will take the next-gen precision initiatives, and without Extension and the trusted communities of our faculty and staff statewide, we are really going to be able to make that difference.
Well, Kathleen, I want to say thank you. What a wonderful presentation, a nice overlay of how all this connects now. I think one of the things that we've really appreciated about your leadership is the ability you've had to bring these component parts together and to help us then see how it weaves nicely with Extension, not to overwhelm the system, but how do you build it in and sort of bake it in so that it becomes part of that next generation of Extension. And you know, one of the things that's been really exciting for me is, and you know this because of our common relationship with people like Roger Rennekamp and others, our national leaders, is that there's been so much talk over the years about health extension and what should Extension really be doing in health beyond the great programs we've had for years working with nutrition education and human development, so many things, rural mental health. But is there a next level to that? Is there another level we need to be going to? And what this really is, this is the next level. This is how you bring all those pieces together and now take a step into that kind of world that we haven't been in before, and to do as I really believe what we've done in the past in so many disciplines, to move that same technology, same science, same opportunities into the field of medicine and healthcare. So, you know, I'm just excited that you're here. And one thing I wanted to ask you, I'm going to ask you a question here. I know that we've heard about all the big stuff, but I think people would really like to know, why did Kathleen Quinn decide to do this? Why be in this space of rural, of health? What is it that drives you in that?
I think understanding the inequities in our state and the social justice issues, and having the opportunity, it would have been easy just to float into retirement with the Rural Track Pipeline program. But knowing that that my voice and Extension's infrastructure, what difference I truly believe it will make. And with the Extension Cooperatives healthcare framework for health equity and well-being that we're going to be talking about this afternoon, that coincidence of bringing equity and well-being out through the infrastructure of Extension across all program areas, because the ag people, the youth and family, the business and development, all of us can make a difference day to day when we meet with and interact with citizens regardless of the program area. And I'm very excited about that framework that, again, we're going to be talking about at 1 o'clock. And I want Extension to understand, again, the impact that we can make.
And wouldn't you say that the whole COVID experience has really brought this to the forefront of people's minds? Do you think that's really made people more aware of health maybe than they were things they took for granted in the past?
Absolutely, and there's silver linings to COVID with the attention on public health and immunizations and, again, health equity, social justice, those types of things that were underfunded, and our health rankings that we'll be talking about later as well. And I think the COVID experience, as bad as it was, in another hopefully 2, 5, 10 years, our local health departments and our health systems as a whole will come out better for our citizens of our state and our health rankings.
Well, Kathleen, I want to thank you again for being with us today. Many of you had already met Kathleen, and what a remarkable leader, somebody we're glad to have a part of the team now. I learn stuff from her every time I'm with her. So there's things I learned today I didn't even know we were doing, and that's not unusual in my business because there's a whole lot going on. But Kathleen, thank you for being with us, and thank you for not only being with us, but leading in such a great way to move us where we need to be for all the health of all Missourians. So again, I say thank you.
Well, thanks for the opportunity, and thank you to everyone that works within Hope, because they're an incredible team, and I'm thankful for them every day.
Absolutely.